So you came here originally for knee pain.
Yes.
You went to 2 doctors.
Mm-hmm.
Tell me what happened with the first doctor.
I had water on both knees. They took that out and they gave me cortisone in each knee. And then they scheduled me for knee replacements. And I said, I can't go through this. They didn't care. They set me up for the operation. They gave me paperwork to study. I read it from cover to cover that night. First thing in the morning, I called up and canceled the operation. Because they said they would do one knee and 3 weeks later do the other knee. Nothing doing. So that was that. After that, I found your ad in the paper and I came here and
So, do you have more mobility with your knee?
I certainly do.
Do you have better range of motion?
My friend and my family even say I'm walking without a limp now.
Without a limp. Okay, so what you did is you took your health to be your responsibility, and I know you paid some money for services that's not covered by insurance.
Happy I've improved.
Excellent, excellent. And you can live like this, you have improved, you're virtually pain-free, you can walk better, your family is saying you can walk better. So our job is to eliminate surgery. And now, are you thinking about surgery now?
No.
Exactly.
No way.
This is what our job is. So I want you to understand something. Just because a service is covered by insurance, that doesn't mean the service that you're going to need or you're going to get. We evaluate you, our physicians do an orthopedic evaluation to see what your needs are. Some services may be covered, some services may not be covered. We tell you what you need. You decide what you want. If you want to go under the knife, if you want to have months of rehab, if you want to have months of physical therapy, if you want to have anesthesia with potential cause of death, this office is not for you. Potential blood clots, this office is not for you. The doctor decides what your needs are, and this is the result that you can potentially get to eliminate surgery. At this age, you don't want surgery, unless it's absolutely necessary. But you need to go to a doctor who has other alternatives. When you go to an orthopedic surgeon, they do surgery. And some surgeries are indicated. There's no questions about that. But our goal at Medwell Spine, Knee and Leg Pain Center is to prevent surgery while we can. God bless.